In today's episode of Tony vs. Universe, I'm back, and my guest today is the same guest I had on the previous week. Roll the cheesy intro. In today's episode of Tony vs. Universe, we talk about endometriosis. 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 But you said there is an endo.
Yeah, I don't know if you're pronouncing it right because I don't even know, but it's like
It's
the
not
sister
what you
diagnosis.
have.
No, it's not.
So after the first episode, you received a few messages in reference to endometriosis.
Mm-hmm.
Can I just say endo?
Yeah, you could say endo.
Endo, the misdiagnosis and symptoms.
Yeah. I mean, there's several symptoms, but I think to kind of start off, the common misconception of it, though, is that at an early age, you're taught, on a female's perspective, that you're taught that your monthly cycles are normal to cramp and it may be TMI. So if men are watching, maybe this can benefit them for their wives, family. I don't know.
Because we care.
But let's disclaim, I'm not a medical professional, and I'm not saying that if you have these symptoms that you automatically have endo, but it's something that you should look into. But
WebMD certified you.
No WebMD. Don't Google, just talk to a professional. But you're taught at an early age that it's normal to have painful cycles every month, that it's normal to have heavy flows consistently every month, and it's not. That's not normal at all. I'm not saying that you should not have cramps, because you are going to have that, but there's just not enough education to teach medical professionals that are going into that field that it is normal or not normal, what the signs of endometriosis are. And so there are several different symptoms, should I say. So
I was wrong. It's not endometriosis. It's adenomyosis.
It's A-N-D.
Nothing to do with. But I think it does have something to do with.
It's like a lot of women who have it. I feel like I have a hair. Sorry. A lot of women who have endometriosis, they also sometimes get diagnosed with PCOS or.
What is PCOS?
Now you're putting me on the spot. I don't know. I can't even say it, but it's
Polynesian.
No.
What is it?
It's like cystic something syndrome.
Polycystic ovarian syndrome.
Yes.
Got you. It's a hormonal disorder.
Yes. So it coincides with endometriosis, but
you just mentioned something about younger or cycles, right?
Yeah, I'm saying like when you're younger, growing up in middle school, at least I'll be 38 this year. So in middle school, when they teach you about puberty, you know, back in the day that it was normal to have painful periods. But I'm saying. So
you mentioned something earlier this week, not to cut you off, but it was a two-part question. But you mentioned something earlier this week about being young. But where's the correlation between being young, starting or entering puberty, and then, I guess, lack of better words, a correlation between birth control? And endometriosis or hormones in general? Or is that just the scapegoat from... It
is, in a sense. And sometimes, I mean, basically every diagnosis is a little different. It's very unique per the patient. But in my personal experience, none of those worked. So...
Right.
Like it's a hormone imbalance also, right? So think about the best way I can describe it to you to kind of understand the concept of it is that when you have endo and it continues to grow, your hormones are just all over the place. So it feeds off of like hormones and growths and things like that. So birth control does not work. Birth control is actually really bad for you. So, and statistically speaking, if you look at the data that's now starting to come out with all of these IUDs, which are the ones that are inserted in you, we've tried those.
Not the roadside bombs.
What?
Nothing. Keep going. I get confused because I'd be like the IUD, be like it's the roadside bomb.
It's part of like hormone replacement, but there's actual like hormone replacement pills as well. I've tried every avenue possible, and it could be because of my seizure medicine that I take because I could never take birth control even before being diagnosed with this. It kind of cancels it out.
I'm actually curious to know why, because you're not the only person. Like, so if you're epileptic, birth control, it's not as effective?
It's basically like taking an antibiotic, like penicillin, amoxicillin.
Right.
It does not work for my body. So I think just being on seizure medicine since I was a little girl, I don't know like what the common factors are why it cancels it out, but it does not work.
Right.
I think it's done more damage than good in my personal experience. But
so what fuels endometriosis? Is this a hormone or is this estrogen? Is it a combination of both? Are they the same thing? Could this be what you eat? Is this hereditary?
Well,
I know it's a lot to take.
That's a loaded question, but
so we'll go with one. Is it hereditary?
It is hereditary.
Okay.
My sister and my mom both have it. Well, my mom had it, should I say. She's not had any symptoms for years. She had a full hysterectomy. My sister's currently experiencing the same thing. So, she just had surgery on Monday, and then she actually had an emergency surgery right before Halloween. So that's kind of, I guess, as weird as it sounds, kind of like a blessing in disguise because a lot of women don't have a support system or even understand like what I'm going through. You try to understand, but someone that's on that level and experiencing things, I think it's good for her and I to just text back and forth. And
but prior to your sister being diagnosed, you found support. There are groups, Facebook groups and Instagram groups, or
there's several that you can, there's a lot of great information on Facebook and forums that I found, but it's kind of heartbreaking because you read these stories and there are women that are honestly, I mean, it affects your mental health too. And thank God I don't suffer from depression with this, but a lot of women do. To the point that they're at a vulnerable state and they're pleading and trying to just have a conversation with what other women are going through that they kill themselves.
Right.
And it's like, I'm probably going to cry talking about this, but like women have died from this because people in the medical professional area of this, they don't know. And I told you about this.
There's lack of research and
a female
funding.
Yeah, she was in I think she lived in the UK. This was last month. She died. She suffered for 2 or 3 weeks. She'd been to emergency rooms, several doctors, and she had an 11-centimeter cyst that no one picked up. No one took her serious, and she ended up needing emergency surgery, and she died on the operating table.
That's crazy.
And so
it's actually pretty nuts.
Yeah.
So I guess I'll circle back around to my other heavy question. I totally just lost my idea. Is it train of thought?
Yeah, train of thought.
Or just idea?
Maybe both.
Or what I was going to say. I'll just say what I was going to say.
Okay.
Say what I was going to say. I don't know what I was going to say. Anyway, oh, yeah, so the lack of funding, the lack of research. Is this something that every OB should know or does know? And you and I have conversed about this before about a lack of specialists in this field.
So I think it's all three. I think it's a lack of funding, which by the grace of God, they're now actually starting to create these summits, and specialists are actually like being taught and being made aware of this diagnosis. And so I think that while it's great that it's finally getting much deserved attention in the research field and the training from a medical standpoint, I think a lot of OBGYNs are dismissive of it because they don't know. And so,
not only OBGYNs, but just medical professionals in general.
Basically putting a Band-Aid on it and saying it's a period or it's normal because it's normal to have cyst, right? With your monthly cycle.
Right.
A normal female, you'll develop a cyst during your cycle and it just shrinks. However.
So what age were you when you were initially diagnosed? We're just talking 2012, 2013.
13, yeah.
Okay. So what age were you then? You were 29?
20, yeah.
30. So what age was your sister when she was initially diagnosed?
She actually was diagnosed earlier on.
Yeah. Okay.
I want to say Zaylin was a baby when she had one of her first surgeries to have cyst removed. So 2009, 10.
Okay. So fall of 2013 is when you first started having episodes. It was immediately after I got back from LA.
Yeah.
Explain the process and the BS that you went through trying to figure out what was wrong with you. And when I say BS that you went through, and I guess you just experienced this here recently at a different hospital, I'm not going to say, but oh, you just want pain meds or you want this. And you're like, no, that's not what I'm asking for. Oh, well, it's just, you should follow up with a GI and you just have, what is it, IBS or Crohn's. Yeah, that's not it.
Yeah. So I think I want to point out too, is that's where they're dismissive because they don't know how to treat it. They don't know what it is. So they don't even know, they don't want to come out and say, I think you have this, because at the end of the day,
right,
on their end, they can't do anything. Right. It's kind of, they're oblivious to everything about it. So then what happened was I started experiencing this like pulling sensation in my lower abdominal cavity, and I knew something was wrong, to the point I couldn't stand up straight. And then it was like a burning sensation. And when I say that it's worse than contractions, like
you were saying searing.
Yeah. It's
like you're searing a steak or
something.
Yeah,
I mean, like someone was torching my insides. It was awful. And so I remember that happened on a Thursday, and I could not get into my doctor because Fridays Friday and Mondays are his days to just operations only. And so that was my first experience. I didn't think there was anything crazy, and I was like, I'll just push through it, and went to work on Friday, went through the weekend, and then I actually went to work on Monday, went to work on Tuesday.
Half day, yeah,
because it was I went at lunchtime, and I worked downtown at the time in the city and drove all the way back out here to St. Charles, and it wasn't even like a full exam. Sometimes they will do like an ultrasound or something, and just like by my vitals, my symptoms and everything, immediately like sent me straight over to the hospital for surgery. And that was because I had a cyst, and he was afraid at the time that I was going to basically lose an ovary, and it would.
And at that time, the cyst was in your ovary.
Yeah, and it could potentially affect me being able to conceive. So during that, they removed it, and it was a successful surgery. And then 2 weeks later, I was laying on the couch, and you were outside with Zaylin. And I remember experiencing like that fire burning inside again, to the point I was in tears, and immediately had to go to the ER. It was after hours it was like 6 or something. And I was admitted, I think, right? Or did it take a few times to go to the ER? You were admitted,
and I believe that was the surgery for the appendix, maybe.
Yeah. And so, but of a lot of times, to kind of go back at the beginning of your question, because now I'm recalling like what you were saying. Yeah, a lot of times they think that women who suffer from this, if they don't know what it is, that you're just seeking pain medicine.
I believe that was in your. I believe.
Yeah, I had to fight.
I wish I knew
to
his
get
name,
because
I would definitely say his name. But the asshole doctor, excuse my language.
Yeah.
Initially,
terrible.
he wrote in your chart.
Yeah.
That you were just attention seeking or something.
And it was.
But you would never request pain meds.
No, I mean, and they were giving me morphine and something else. Like, and I mean, it was not touching it, and that's how much pain I was in. So once they admitted me, and then they did they did a hiatus scan, which basically is just testing. HIDA, thank you. Testing to see the functionality of your gallbladder to make sure that it's, I think, operating at like functioning at 75%. That's like the max, I think, is what they look for.
Right.
But they made an error in the ER, and they gave me pain medicine, and you're not supposed to do that before you go in for that test. So I learned that while I was in there. I mean,
but I wonder why that is. Does it decrease the function of that organ?
Probably.
So, 10 years later, is that the pathology report that said that
my appendix was fine.
Fully functioning? It was fine.
Yeah, it was fully functionable and fine. But when I did my colonoscopy before, so I had to scheduled a colonoscopy. Yeah, that was terrible. Before they actually removed my appendix.
Right.
And the doctor who did the colonoscopy in recovery came out and verbatim told me that my gallbladder was inflamed and at some point it's going to need to come out.
Right.
However, I was in so much pain and I had no idea about what, like everything was going on.
You're
and I was
trusting
like,
the guy who went to school for 10 years.
I was like, just take care of whatever I need to feel normal. Like, I don't know what's happening. And they took my appendix out. So, it was a surgery, a costly surgery in an organ that.
So are we still in 2013 or are we in 2014?
This is still 13. This is, 2 weeks later.
So this is all at once. This is just.
Yeah, like 2 weeks after the first surgery.
Yep.
Yeah. So that's just kind of like the
I'm asking you questions like I wasn't present.
No, but I think it's good so people can understand
right.
the process. I think,
So what testing can they do that actually show cysts growing in your stomach? Ultrasounds, internal ultrasounds, x-rays, CAT scans?
It depends. Here recently, 2 weeks ago when I was hospitalized, they did an ultrasound and they couldn't even find my ovary. So it just depends.
It's in there somewhere.
And then they did a CT scan and they found it. And then that's when they seen the cyst.
Right.
They can do an internal transvag ultrasound, and they can determine and see if you've had a cyst rupture, if there's free flowing fluid, if there's blood that's in the cyst, and if if your stomach's filling up with blood. It just depends. Honestly, it's unique and it's different for every person. But those are some of the tests that you can do. However, to be diagnosed with it, it's unfortunately.
So from 2013, when you initially had issues or started exhibiting symptoms, how many years later? Because it wasn't right. What was it? Months later, a year later, where you're actually diagnosed with endometriosis? Yeah,
I think it was like the following year, a year and a half later, when I had the other a third surgery, should I say.
So back to the loaded question, I'll pick one out of the hat. What fuels it? What feeds endometriosis? Is it estrogen? Is it hormones? So is there any current hormone therapy on the market, like medications? Actually, I do know that there are medications because I've been reading a book. It's called Endometriosis.
Really?
No, I'm not. I just Googled it one day.
I was like, that's cute.
Anyway. But the side effects are almost worse than what...
I'm sweating right now. Yeah. It's like, it's honestly, there's so many side effects. We could be here for hours, but my personal experience, very lethargic, anxiety. I've never had anxiety. I was never diagnosed with it in my life, but that was only diagnosed when I had my partial hysterectomy.
Right.
Because I am going through what they call partial menopause symptoms. I say partial because I still have one ovary and one fallopian tube. I don't have a uterus anymore. So painful intercourse. Some women have IBS, a lot of GI issues. You're prone to depression. I mean, there's so many things that...
when you say we're talking about OB practices or I guess topics in general, but endometriosis isn't limited to just female reproduction system. It could grow anywhere.
Yeah, so it can grow on your heart, your brains, your lungs, your kidneys. It can infuse your organs together, which is currently like what I just found out on Valentine's Day.
Right.
In your intestines, bowels. I mean, it wreaks havoc all over your body, not just internally, but like I said, physically, mentally. I mean, there's days where I can't do anything, but and I've told you this before, and I think it's because I was diagnosed at such an early age with epilepsy that I was like, I'm never going to allow a diagnosis define who I am, because you're told, I was told that I couldn't have kids.
Right.
Being epileptic. I couldn't drive.
Boy, they didn't know until they met me.
I wouldn't have a career. I wouldn't do anything, right? Like I was limited. I was going to be disabled. And I was like, absolutely not. I am breaking that barrier of that statistic. And I did.
You did.
And so when I got this diagnosis, I didn't know the extent of everything or how my body over the time would like suffer. For me, I may even get emotional for this. At the time, we were set to not have any more kids, right? Like, we're good. And for endometriosis, I had a timeline from my OB because I had precancerous cells. And so it was, if you're going to have a baby, you need to have it in a year. I said I wasn't going to cry. And so I was like, okay. And we were done. And then, at the end of 2019 in the fall, I was in and out of the ER, in and out, just in pain, so many cysts. I want to say it was October, I had a surgery to remove a cyst. And at that point in time, I was not getting any better, and I was consistently in pain. And I kept putting off that partial hysterectomy. I was like, no, I'll be fine. I can push through the pain.
We're talking the end of 2019,
the end
beginning of 2020.
Yeah, the end of 2019. And so after I healed from that surgery is when we went ahead and scheduled the partial hysterectomy the day before New Year's Eve. And at the time, it was because I was in so much pain that I didn't mentally prepare myself, right? Like, okay, this is going to make me feel better. I'm going to be able to be a better mom, a better wife. Like, I can work and do all of these things. And then you're just robbed from it. Like, you're taken, they're taking everything from you. You can no longer have kids. Like, that should be a choice for me. I shouldn't be able to have a surgery because of a condition, and I'm no longer able to make that decision on my own. You know what I mean?
The universe did it.
Yeah.
Hence the show.
Yeah. And I think that for a lot of women, that is hard to swallow. Till this day, it's hard for me to accept, but I know it's for the better good and the quality of my life.
Right.
And I was fortunate enough to even carry one. There's women out there who can't, who cannot.
Boy, did we luck out with him.
Yes, we did. He's great. But there's women who had to do fertility and still cannot get pregnant.
Right. So, is the absolute means of diagnosis exploratory surgery?
Yes.
So they can see. I need to Google that too. Everything's Googleable on this show. Googleable.
Did you?
I just coined that. I might use it later. But so on the CAT scans, X-rays, MRIs, anything, do they know for sure it's a cyst, or they can just surmise or assume that it's something of that? And so once they get inside, it's like, okay, this is actually what it is. So what is the process that they do to remove the cysts?
Well, it depends. So for OBs who are not considered endo specialists, they will go in and basically just remove what they need to. And if they see the endo, which is also, they refer to them as lesions, which are kind of they can either be pockets of clear pockets, or they could be darker. They'll go in and remove those. And the best way for me to describe it for people to understand who have no idea what I'm talking about, an OB who has knowledge of endometriosis, just the surface level, when they go in to do surgery, think about you cutting down the tree in your yard, right? Mm-hmm. You're only cutting to the stump to even out the ground level. You're not going in to dig out the roots. The specialist is the one who will go in and actually go through everything, all of your organs and surface, to make sure that they're getting everything. So there's certain ways that they can do that. They can go through your, in my experience, and I can't speak for everyone, or I know there's other ways, but they've always gone through my belly button, and then I've always had at least 2 to 3 incisions, really tiny incisions, in my lower pelvic area. And they burn them off. I don't know the term of what they use, but they burn it off. Yeah. So
they study in med school.
Yeah.
Like the third year, they're like, it's called burn off. What's that? It's where you remove. Okay. So after the removal of that, how long do you think it took for you to have another cyst or for it to grow back?
Generally speaking, I feel like, I don't know, 6 months?
Mm-hmm.
I don't know. I mean, I can't pinpoint. I just feel like since I had COVID, I've had a cyst rupture and currently have another one, and we had COVID over Christmas.
Right.
So it's pretty frequently that it's happening now. Faster, should I say now than ever.
Yeah.
Granted, I could have had cysts grow pretty rapidly and just not even experience any symptoms. And some women do. They have no symptoms. And
or just experience them whenever they're
very minimum
cycles,
to where they don't think that it's anything. Yeah.
Right.
And so I just happened to have an OB who was like, this is not normal. This is not your normal period, cramping, and discovered it. So, and granted,
And that's who I met, the guy that was explaining stuff to me.
Yeah.
Okay. So he shows me the pictures and he's like, this is what this is. I'm like, bro, looks like fuck. I don't even know what it is.
I was
But all
like,
right, yeah.
I remember like asking you after I.
Did you ask him what was in there? I'm like, how was I don't.
I'm like, did you
skip
not
that
take
part of
any notes? I need to know.
Yeah, I skipped that in anatomy and physiology. Okay. So, here recently with research, and what are they doing online? Because you've been watching these.
Oh, weekly summits.
Okay.
Yeah. So it's a.
Now I got to Google that.
Forget.
What is a summit? I know what a summit is, but why do they call it that versus like an online?
I'm not sure. So it's hosted. Actually, this month is Endometriosis Awareness Month. So this is perfect timing to talk about it. But there is a weekly summit that they post on Facebook, and it's just doctors discussing different treatments, different data that they found and discovered, things that they're doing in the endo community to help out, guide other medical professionals. I mean, there's just a large amount of topics that they try to cover.
So there is currently progression in reference to research or possible cures or therapy.
Yeah,
of that nature.
And some therapy works for some, and I mean, it's not like a one therapy works for everyone, right? Like.
Yep. So on a scale of 1 to 10, the least your pain has been since 2020, because we're only in March.
The least amount?
The least.
I mean, there's been days that I don't experience anything.
But that was prior to this gigantic flare up here recently.
Oh, yeah. I mean, I just had one right before we went on camera. It's like a lightning bolt, and it like literally feels like you're being shocked to your core, and you just take your breath away.
So scale of 1 to 10, the worst that you've ever.
Like a 20, honestly, to the point to where
you're like curled up in a ball.
When my last hospital stay, which was 2 weeks ago. Like when I say it was off the Richter scale, they gave me Dilaudid. I've never taken that in my life, had it given to me. It was not touching the pain at all.
Really?
At all. So they were giving it to me every 2 hours. And to the point, like, I think it was too much for my body to handle with that being in pain that I started to, like, violently shake. I didn't go into a full seizure, but I was like, do not give me this anymore. I will push through it. Just give me ibuprofen because.
And you're just like, I want to go home.
I want to go home. Like, you're not doing anything. Like.
So sometimes when you're in pain, it's almost pointless to go to the hospital because no one knows.
Sometimes
and they can't even treat it.
Yeah, most of the time. And honestly, I know, and you have the best intentions, right? Like, okay, enough is enough. You have to go.
I'll be like, drink some soup.
But I'm like, no, I'm saying to even get me to go to the ER, right?
Right.
In my head, I already know that all they're going to do is give me pain medicine and put a Band-Aid on it and tell me to follow up.
But in all reality,
with the doctor.
most of the times, I really want to fight you because you'll be feeling bad all morning and then you'll wait till like 8 or 9 at night. And I'm like, so now you want to go to the hospital? And then we end up spending like the night in the hospital or picking you up at like 2 in the morning.
I mean, I think.
Oh, I still love you though.
Thanks. But I think it's like a thing for me that I can just push through it, right?
Right.
I can handle it. I've been through this before. I know it's going to wear off. And unfortunately this time it did not at all. It just got progressively worse.
There's more. It's like an infomercial. But guys are not exempt from this either.
I don't know the anatomy.
Could this be guys who take hormone pills?
Maybe.
Or
I
like
don't know.
testosterone
it was
or something?
just, honestly, it was listed in one of the forums and it's been a topic in multiple ones. So I haven't even researched it myself, but I thought it was pretty interesting. I don't know.
That is bananas.
Did you find anything?
Yes, I did, unfortunately.
What did it say?
Everything that you talked about, and I don't want to talk about it. I don't even want to put that in the universe. See what I did there? Because and then, okay.
I mean, the
You'll
thing
get it
is,
later.
though, is I think that to talk about it, it's
the same thing, abdominal pain.
Yeah, and a lot of times, too, doctors, since they're not familiar with it, it's like a GI issue, right? So, like, if you were to have this symptoms and go to the doctor, they're going to treat you with a GI.
Well, I guess, scary thing is, and I'm not taking anything away from these people in their particular discipline, but you have people that are medical professionals reading your tests, and they don't know what they're looking for. And then they're like, oh, you just have IBS, and they send you home.
The only thing that I can tell you is you and I have had this conversation before. I have had nurses and doctors who have been phenomenal. And when I say that, it's not just like trying to manage my pain and find like the solution. It's also like their bedside manner, right? Like they understand what I'm going through, whether they have it themselves, they have a family member who have it. And then there's other times where you have, and I've said this, I have a male OB. My specialist is a male. I would prefer a male.
Is that the attractive one?
He went to infertility.
Oh, that's right, because I did ask that dumb question. Can I ask it now?
Yeah, you can.
No,
go ahead. No, I mean,
so
no, because a lot of people may have different opinions.
Do you even know the question that I asked you?
About, like, if I had a really good-looking male OB, would I change?
150% no.
Oh.
I said, do women wear, like, cute underwear to the OB?
Oh, I don't, because listen, when you go for your appointment, any female watching this can contest to this that
they're just like in a gown already coming, like sitting in.
No, you go in and then the nurse is like, okay, take down, and you get like this tissue paper and you put it over your lap and then you just lay there and you're sprawled out. They're seeing your goods, so it's not like,
right.
Why do you care what my underwear?
I guess that is a good question.
I fold my clothes up though, so you don't
like
see
neatly.
Yeah.
But I guess that's a question to ask, not like they're going to respond because we're not live. But I mean, do women prefer like males or females? You said males, but for what reason?
In my experience, it's males have better bedside manner. They're more sincere. Not saying that females are not, so I'm not trying to like.
So they can't relate, and they're really trying to figure out.
Yeah, and I've experienced that. In my experience, now there could be amazing, and I'm sure there are because I've seen them on the forums that are wonderful. But in my personal experience, they just are not sympathetic at all because I think that they may put into how they would handle a situation, or they're not familiar with it, or they're just it's not that bad.
And
it's
you're
just
like,
cramps. And
excuse
I'm like,
my language, but you're like,
it is that bad.
Can you curse? Because I can't curse anymore on the podcast.
I just said bia. I watched.
That's not okay.
But it's like, you know, it's funny because my mom used to say when she was in labor with me that she didn't have an epidural, right? And the nurse, I believe, was like, it's not that bad. And my mom verbatim asked her, like, have you ever had kids? And she was like, no. And my mom was like, don't tell me how bad this hurts, like screamed at her. And that's how I feel too. Like, if you don't know what I'm going through.
It feels like shitting at night. Oh my God, my life. Good job, babe. What the fuck just happened?
That's the universe.
How the happened?
I don't know.
Maybe I didn't do it tight enough, or you're. I got to blurb out anymore on the podcast.
Anyway, so yeah, I think I prefer a male. I've had great experiences with my male doctors, and that's not in a weird way at all.
She puts on like makeup before she goes.
No,
to the
I
OB.
don't. When I tell you I look.
Well, it's
got to
be true then.
What?
Not to get off the topic, but it's got to be true because there's women who wear makeup to the gym. Like who put on makeup to go to the gym.
Crazy.
No, so there's have to be women
I'm
who
sure
get
there
up and
are.
well,
like,
I guess you want to be
no,
look
I
presentable.
think it depends. Like I've gone to the doctor there,
Guess
like just for a normal
pointless.
checkup, leaving
Right.
work. So I'm in like, you know, not dress clothes because it's business casual at my office, but I'm definitely like have makeup on my hair done.
Does he say like, "Oh, you look really nice"?
No, he's just super. No, he doesn't. He's not a creep.
If you watching this shit, you better be on your P's and Q's.
Amazing. To the
buddy.
point that I've referred 2 other people to him.
That good, huh?
He's seriously like the sweetest.
Okay, so how many people have reached out to you here within the last 365 days about them exhibiting symptoms of endometriosis?
I mean, I would say maybe like a handful of just like close family friends.
So here recently, since we released that podcast, and I don't even remember us talking about that.
It was just a briefly note that we touched on, just based upon like you being a great husband because you were you.
What the fuck are you talking about?
Whenever I.
Oh, you talking about me being a good husband?
Yeah,
oh, I thought you talking about. I was like, what are you talking?
Yeah, and so it was kind of like a segue that I brought it up.
Yeah.
I mean, I've had friends that have struggled with symptoms and. Hey, I think I have this. Like, what do you suggest?
Right.
I mean, there's so many different things, and I'm not an expert by any means, but it's...
Apparently, you know more than the medical professionals.
I mean, and it's sad because a lot of us, and I say us, women who unfortunately are part of this horrendous club, you do your own research, and you find all of this information that is available to them.
Right.
Right? And so...
So it's just being vigilant and being able to advocate for yourself.
Yeah, you are your own advocate.
What you've experienced, I guess, to summarize it, initially you started having symptoms of endometriosis. You weren't diagnosed for a year and a half later, and it was just written off. It was in your chart. Oh, she's just attention seeking, or you want medication. And because I've said this to you before, it's like pain isn't logical. So there's no way you can have a headache, but your pain could originate from your jaw or your neck or your back. It could be anything. And it's so hard to, I guess, articulate that to doctors. And it's, again, I'm not talking about their profession,
I know.
but they go into the system and they're like, headache, back pain, stomach pain. And they're like, oh, great, you have AIDS. No, you're like, no, I've had surgery. This is what I was diagnosed with. But it's hard to do that unless you're vigilant. And some people would just give up. Like you said, the lady, she was overseas that died or something?
Well, she died on the table. But, I mean, and that was because they weren't taking her seriously. They thought she was, out to just seek attention.
You can literally see the softbox in the thing. But keep going.
It's fine. But, yeah, there are women out there who commit suicide because it's like, when I say you were exhausted and like to the point you can't even get out of bed, right? All you want to do is be able to enjoy a meal. And I've said that to you. Like, I just want to eat food and I couldn't eat food.
You found something at Trader Joe's here recently.
Yeah. Yeah, I'm obsessed with it. But it's like you have to change your diet. You have to do all of these things. But I think it's truly important that you have a support system. And I feel it like breaks my heart to read some of those when they post them and they feel like they're a lost cause. Divorce, their husbands are divorcing them because they can no longer be intimate, or it's been a while, or they can't have a baby, or they just can't be normal. And when I say normal, it looks different for everyone. But
so you can't run out and do cartwheels and frolic on the beach.
Run through a field of sunflowers? No. Not today, at least. But I think that, it's very sad. So having that support system and having someone that you can just talk to, even if they...
Well, you have your sisters and your mom.
Yeah, I know. But I'm saying like outside of my family who have it and have been through it themselves, or my sister who's currently going through it, like I have you who understands to an extent and tries to like basically pick up everything on both ends, right? For our family. But it's like, at what point, and when I say I'm not speaking about myself, but women who suffer and hit that depression, it's like, what are they fighting for? They don't have a family. They don't have anyone.
Right.
And so it's like their doctors don't believe them. They've been everywhere. And there's not specialists in every state.
Right.
So.
But you figure by now that there would be some type of criteria.
You would. I'm hoping that's what it is.
A standardized
going to be
testing, or what is it? What's the word I'm looking for? Assessment or evaluation to determine or diagnose people from this particular condition.
And the sad thing is like, I
almost sounded like I knew what I was talking about. Shit.
I don't even know if I've told you. I may have told you this, but on my chart, it's actually flagged because I've had so many CT scans that I have radiation exposure. So
Now I have to Google how long should you wait between
so
CT scans or X-rays.
no, it's not even how long. It's the amount of CT scans that I've had in the past 10 years, 12 years. So it's like, when the past 2 weeks, it was literally like I had to have a firm conversation with the ER doctor and the nurse because I was terrified of having that. But they were like, we don't have any other tests that we can do.
Right.
We can't even see your ovary or, your fallopian tube. We have to be able to do this. And I said, what am I risking? Because it's already on my chart that I'm at radiation exposure.
Right.
So it's like things that you run into with that too, right? Like, what's your limit? And I don't know medically what it is, but at what point I can no longer have those CT scans and then I'm just going to have to go into surgery because other tests aren't going to pick it up. Blood tests don't do it. So, I mean, there's just...
Well, hopefully they can figure out sooner than later what is actually fueling it.
I mean...
like I said, whether it's fueled by hormones or estrogen imbalance or whatever it is. Oh, shit. I just came over to cure.
What?
Testosterone pills.
They have those.
Does that work? But then you'll start getting like muscles and shit, and like
there's
facial
like
hair.
estrogen. Yeah, there's medicines. I mean, when I tell you that we've tried everything even before surgeries and it doesn't work for me. But I think too that it's...
And they haven't always pressed you about surgery. A lot of it's been like, why don't you go ahead and think about it?
Yeah, I mean, unless it's an emergency.
However, when you're in pain, it's kind of hard to make sound decisions.
That's the thing. It's like, I know I'm going to have a surgery this year.
Right.
However, I am trying to avoid from going into full-on menopause. So it's like, what can I do to, I guess, prolong it? See, like, if the cyst shrinks, if it's going to continue to grow.
But here, as of lately, the frequency has decreased and the intensity has decreased also.
Yeah, and the swelling has, which is great. I'm not complaining by any means, but...
I don't have that thing. Yay. Okay.
But yeah, I think that hopefully they're on a path of new discoveries and teaching techniques for anyone going in that medical professional field. So we'll see.
Well, actually, it's been fun. This topic is so exciting, man. And then my light fell. Every time I do a podcast, I always have an interruption.
I feel
with
like
technical
there's a glare on my glasses too.
I know. I tried. Well, it's because it's the catch light because it just came forward. But every time I have an issue, why are you winking at me? What's wrong with you?
You just look cute. I got something in my eye.
Yeah, apparently I'm wearing a sweater. Okay. Any event, well, thank you for tuning in to an episode of Endometriosis Talk with Ashley and Tony.
Yeah, thanks. Thanks for covering this topic.
Yeah, I realized I didn't give you the platform the last time. So
it's
like,
I just feel like at least someone, just any information, hopefully it could help someone.
Right. Well, anyway, since I can't curse, peace out, bitches.
You just did.
I know.